In the wake of the latest NHS Providers survey warning that fewer than half of trusts now expect to meet key end-of-year elective recovery and cancer targets, Saffron warned us that alarm bells should be ringing across Whitehall. But I fear it will be your telephones that will be ringing with Steve Barclay at the other end of the line, demanding to know what you're doing about it. And I must admit, I found accounts of the Secretary of State's phone calls over the summer baffling and infuriating. Baffling because it doesn't strike me as a particularly constructive way to work with your partners. Infuriating because I think it's a bit rich for the government to lecture others on the responsibility of leadership, given the chaos we've seen in recent months and the fact that so many of the problems confronting the NHS have either been created in or exacerbated by government. So no wonder the theme of your conference is resilience. Perhaps the most important message for me to leave you with today is that a Labour government will want to work with you in partnership, because I genuinely think it is the only way we will be able to grip the biggest crisis in the history of the NHS at the same time as taking the right long-term decisions to make the NHS fit for the future. I love the NHS. Like the overwhelming majority of people in our country, I am proud of the fact that it is publicly funded and free at the point of need. When I went through my own experience with kidney cancer last year, the one thing I didn't have to worry about was the bill. And it is because I love the NHS and want to defend that equitable principle at the heart of our health service that I've been so brutally honest about its current condition and the existential threat it faces unless we change how our health and social care system works. Even before the Conservatives crashed the economy and created a black hole in the public finances, it was clear that there is no future for the NHS that involves pouring ever larger amounts of money into 20th century care. We're spending far too much on late diagnosis and more expensive treatment because we don't focus enough on prevention, early intervention, and social care. The case for change is unarguable. Firstly, the consequence of the economic disaster that unfolded after the mini-budget is that fiscal policy will be tighter. So in a time of constrained resources, more of the heavy lifting will need to be done by reform. Secondly, to be sustainable, any system or organisation needs to keep pace with the times. The challenge of demography and the opportunities of life sciences and technology mean that we must evolve, and there are enormous opportunities in doing so. Thirdly, people working in the system today need hope of a better future and belief that there's a plan to get there. So as the party that aspires to govern after the next general election, we feel a particular weight of responsibility to provide that hope and belief in a better future. When the president of the Royal College of Emergency Medicine warns that hospitals are becoming lobster traps, it needs to be a wake-up call met with action. Thousands of patients every day are stuck in hospital when they don't need to be there, some for months at a time. It is miserable for them, reduces capacity in the NHS, and is more expensive for the taxpayer. And it's no use blaming ambulance services for the queues outside the front of hospitals, or indeed blaming hospital leaders. The Conservatives' mismanagement of the NHS and their failure to fix social care over the past 12 years has left the system gridlocked as it approaches winter. The chaos in the Conservative Party has prevented them from delivering on their own promises to the NHS too. Not a penny of the funding earmarked to increase capacity in social care this winter has left Whitehall. Not a penny. Every day of delay means less time for health and care services to prepare. Steve Barclay needs to pull his finger out, get that funding out the door before it's too late, and ensure that patients aren't stuck in hospital any longer than they need to be. The best NHS leaders aren't waiting for the government to act. Trailblazing trust leaders are voluntarily giving up funding to invest in local social care beds. They recognise that it's better value for money and means better care for patients. So that's my challenge to you and my test for the new integrated care systems. And as well as short-term action, we need long-term reform, a long-termism which I think Saffron reflected very strongly in her opening remarks this morning. A shift in the focus of healthcare out of the hospital and into the community. That will be at the heart of the 10-year plan for change and modernisation the next Labour government will undertake. It's not only because of problems in social care that we see patients in hospital who needn't be there either. Patients who can't get a GP appointment are ending up in A&E. Others are reaching crisis point because they're made to wait years for mental health support. Unfortunately, what's best for the patient can also be good for the taxpayer. I know there are lots of you here today who provide services in the community. Recently, I spent time shadowing a district nurse in Romford in Essex with the Queen's Nursing Institute. I watched her at work caring for a lung cancer patient in the comfort of his own home, freeing up a hospital bed for someone else, providing palliative care to another man dying at home surrounded by his family. This should be the future of care, care in the community. And district nursing will be at the heart of Labour's plan for modern community care. So we will double the number of district nurses qualifying every year. And for all children, but especially kids from working class backgrounds like mine, our life chances and even life expectancy can be determined from the moment we're born. Health visitors have such an important role to play in early childhood development, but the Conservatives have cut their numbers by a third. Every child matters. So we will train an additional 5,000 health visitors to tackle the shortage and give every child the best start in life. And the COVID pandemic has left a lasting legacy on the mental health of our nation too. I doubt that we yet understand fully the impact lockdowns have had, particularly on children and young people. So Labour will hire 8,500 new mental health professionals, providing support in every school, guaranteeing treatment sooner, and taking pressure off hospital wards. Medical science and technology offer a world of possibility to transform patient care. Technology can diagnose patients more accurately than the human eye. Virtual wards allow people to receive hospital care at home. But the biggest prize of all is the advance in genomics and the data revolution that will allow us to transform our model of care from one that diagnoses and treats illness to one that can predict and even prevent it. This will also be at the heart of Labour's 10-year plan for change and modernisation. Then there is the issue at the heart of the immediate crisis, which is a workforce crisis. The Conservatives' failure to train the staff the NHS needs has left doctors, nurses and allied health professionals overstretched, overworked and burnt out. The government have been relying on goodwill, with nurses doing £2,000 worth of unpaid overtime a year to make up for the shortages. Now, I don't think anyone here would blame nurses for voting to take industrial action, but I am worried about the impact strikes could have on patient care. The single best thing Steve Barclay could do to help the NHS through this winter is to get round the table with the unions, negotiate and prevent these strikes going ahead. Now, I understand there was a meeting with the Secretary of State and the unions today, but it was unbelievably negligent of ministers to refuse to even engage with the RCN until the votes had been cast. And of course, it's not just pay that has driven nurses to this point, or indeed other health professionals. When I visit hospitals, the first thing they tell me about is the shortage of staff. Nurses are going home at the end of the day exhausted, but also carrying the moral injury of knowing their patients haven't received the care they deserve. One nurse told me she knows the problem can't be solved overnight. She went through the training process. She knows it takes years, but she just needs to know the cavalry is coming, that things will get better. Well, the cavalry is coming with Labour. We will deliver the biggest expansion of medical school places in history, doubling the number of places to give the NHS the doctors it needs to provide the care that patients deserve. We will create an extra 10,000 nursing and midwifery clinical placements every year. And we will fund this by abolishing the non-dom tax status, which will bring in double the 1.6 billion our workforce investment will require. Because we believe that patients and the NHS need doctors, nurses and staff more than the very wealthiest need tax breaks. It's a serious plan that has attracted widespread support, including from some surprising quarters. A certain Jeremy Hunt, writing as chair of the Health and Social Care Select Committee, said Labour's plan is, and I quote, something I very much hope the government also adopts on the basis that smart governments always nick the best ideas of their opponents. So on Thursday, our Chancellor has the opportunity to put his words into practice. So I hope he puts his money where his mouth is and nicks Labour's plan. He is genuinely welcome to it. And alongside serious investment in recruitment will sit serious workforce planning. We're committed to establishing an independent workforce body tasked with providing independent assessments of current and future workforce needs, as well as advice on training and recruitment pathways and CPD. And I hear the voices in the sector telling me it's not just about recruitment. We need to retain the good people we already have. So I've been putting pressure on the government to act, raising issues like the early retirements forced by doctors' pensions, and on the low pay in health and social care that sees staff poached by retailers. But I'm increasingly worried that we will inherit an even worse situation than we see today. That's why my immediate priority in government will be on the 3 R's of the workforce challenge: recruitment, retention, and returners, to build a new generation of staff, to keep the brilliant people we have, and to encourage people who've left the system to come back. And in return for more investment in staff, we'll expect higher standards for patients. Longer waiting times cannot become the new normal. They are miserable for patients, and they are holding our economy back. Hundreds of thousands more people are off work, long-term sick, than before the pandemic. Long COVID is, of course, playing a part. So too are NHS waiting lists, according to the Bank of England's Monetary Policy Committee. Poor mental health is driving young people out of the labour market. You cannot have a healthy economy unless you have a healthy society. That's what the Conservatives don't understand. So I'm not going to expect you to meet performance standards overnight. I wish I had a Labour magic wand I could wave. But nor am I going to pretend they don't matter either. An incoming Labour government will want to agree an ambitious but credible timetable to ensure that they're met. And I've done a lot of mystery shopping on the NHS as a cancer patient in the last 18 months, and I don't think the patient's voice is heard loudly enough. So as Labour's Secretary of State for Health and Social Care, I'll be the shop steward for patients. That means better use of technology to give all patients the ability to book appointments online, the opportunity to self-refer to specialist services where appropriate, and a wider range of choice so that we can choose to see someone in person, on the phone, or via video link, because I recognise that every patient is different. I value fast and convenient access. I don't mind if I don't see the same person every time, and I'm very happy to see them on a screen. But that isn't appropriate for everyone. Continuity of care benefits patients and takes pressure off other parts of the health system. But 2 in 3 patients rarely or never speak to their preferred doctor. So I've committed to introduce new incentives for continuity of care to bring back the family doctor. That's the kind of change I want to see. Resources where they are better spent, pressures removed from hospital through better primary care, social care, public health, mental health, and diagnostics. And Keir Starmer recognises that so much of what determines good health and well-being and creates deep health inequalities in our society is decided outside of the NHS and the Department of Health and Social Care. His leadership and deep personal commitment to the preventative approach demanded by leaders like Michael Marmot will be crucial to making this a cross-government priority. And I want your help to make sure we get this right. So let me just say this in conclusion. Thank you. Thank you for the leadership you showed during the unprecedented challenge of the pandemic and for busting a gut day in, day out since. And thank you for sticking with it, because I know that politics has made your jobs harder, not easier, and I have a responsibility to fix that. The country needs you, and we'll need to work together to build an NHS and social care system that's fit for the future. And that's why I'm delighted to be here today and to be taking your questions, what I hope will be a really good exchange of ideas and challenges. Thank you.
Thank you so much. So there's one question that's come up quite a lot on the sort of submitted question, so I'll put it to you and then we'll take questions from the room, which is on this issue of kind of retention. There's a lot of interest in the fact that nurses and student fees are a big issue. So let me just wait where it's worded. Hang on. One way to address retention for health workers would be to pay off student loans after they serve 5 years or more in the NHS. Another one's suggesting, would you consider, kind of abolishing nurses needing to pay for their degrees. What's your thought about this as part of the retention issue?
Well, I'm a former president of the National Union of Students, and the very first end-of-day adjournment debate I led in Parliament as a newly elected MP in 2015 was in opposition to the abolition of the NHS bursary, because so many of us warned then that this would have a completely detrimental impact on our ability to recruit people into the profession, especially when you look at the sort of demographic profile of traditional entrants to nursing, midwifery and allied health professions. It is something that we are looking at. In fact, just this morning I was at the University of Chester's Medical School talking to first, second, third and fourth year nursing and midwifery students, and that came across really powerfully this morning. So I'm looking at it. I wish I could be more affirmative today, but one thing you will hear as a kind of common refrain in the run-up to the next general election is we are, especially as the Labour Party, when the question for us as an opposition is always, can we trust you with the money? But also against the backdrop where trust in politics and politicians is so low, and somehow I don't think Matt Hancock's appearance on I'm a Celebrity is going to persuade the general public that we are all nice, lovely human beings, which I think was his ambition. I just think we've got to make sure we don't make promises we can't keep. So I promise you it's very much on my radar. We are looking at it, and I accept the case that's been made that this would make a difference. I just need to be confident that I'd be able to deliver it before we promise it.
Right, we're going to take questions. If I could ask everyone to keep their questions really nice and concise so we could get through as many as we can in the time we have. So I know that number one, I'll take that microphone first.
Hi, it's Julian Hartley, Chief Exec at Leeds Teaching Hospitals. Wes, you'll remember visiting Leeds with Rachel Reeves in June, where we showed you the ground clearance ready for the new Leeds Children's Hospital and the LGI development. We, along with 6 other major capital schemes, part of the government's new hospitals programme. And obviously, we believe, and I'm sure many of my colleagues involved with schemes in that believe, the NHS capital investment plays a key role in innovation and economic growth in every place that happens. So I'm interested in your perspective on capital investment in the NHS and how schemes like ours can galvanise growth, inclusivity and benefit for communities.
Thank you very much.
Firstly, thank you to Leeds, because it's not easy to get £1.6 billion out of the Shadow Chancellor. And I'm in no doubt that's because she is well briefed on the challenges in the NHS, thanks to you guys. On capital, there are a few things I'd say. One is when you compare the UK's health system to other OECD countries, we seriously lag behind when it comes to capital investment, and I understand the pressures there. I think before we even think about demands for new capital commitments, I also understand there's a challenge and a frustration for some trusts that they are sitting on pots of money that they could spend on capital, but Treasury rules prevent them from doing so, and something I'm actively looking at. We also understand, I think, the role that the NHS plays as an anchor institution in a place and in a local economy, and I think we see it through that prism too. I'm really conscious that when you look at the NHS backlog as well, and you look at the conditions that people are working in and the need for improvement in the existing estate before we even think about the new estate, there's lots to do. So it's very much on my radar. I'll just say 2 things finally. One, this comes back into the category of not wanting to make promises I can't keep, and I think we've seen with the 40 new hospitals that only existed in Boris Johnson's imagination that we don't want to kind of start promising the earth and then under-deliver. We'd rather do it the other way around, under-promise and over-deliver. And the second thing I'd say is it's a bit rich for the government to lecture the NHS on the need to find efficiencies and to improve efficiency and productivity when it's delayed decision-making at the heart of government that means that projects are ready, projects are fully thought through, right through to planning application stage, and then people get deafening silence for months and months with no idea when the Treasury is going to unlock the money that's been promised. So I think one of the things that would help the NHS to improve its efficiency would be if government improved its efficiency.
Thank you. Right, wave the paddles. Right, we've got number 2, and then I'll take number 4. Thank you.
Hello, Wes. My name's Patricia Miller. I'm the Chief Executive of the Dorset Integrated Care System. So my question's on a different subject than Julian's. I've worked in the NHS for 34 years, and actually if I count the number of hours that I've worked, I probably should have retired when I was about 35. We get lots of bad press about NHS management and leadership. The reality is that we have less managers as a percentage of running costs than most other countries in Europe. A significant proportion of our leaders are actually also oscillating between leadership and clinical roles. And actually, I think the NHS is undermanaged when we think about the transformation we need to make going forward in terms of integrated care.
And the question is?
How can we be confident, if Labour get in the next election, that they will have our back in terms of NHS leaders, as opposed to the message that constantly goes out to the public is that we're a burden and a cost?
Thank you.
Yeah, it's a fair question. Well, I can give you a proof point, which is I went on Talk TV and Talk Radio and went up against Dr. David Ball, who made the claim that the NHS was overmanaged, and strongly rebutted him on a channel that I do not think would be necessary, and with a presenter that I don't think would be necessarily sympathetic to the argument that I was making. I think good quality leadership is really important, and it comes back in some ways to sort of the challenge I set out for the way in which we waste money in the system and the way in which we deliver worse patient outcomes than we might otherwise, which is, you know, we get there far too late in terms of diagnosis, and therefore we have more expensive and less effective treatment, and we need to shift that around. And you can't do that overnight, and that's why I kind of talk about a 10-year plan. And you can't do that by just asking the front line to deliver transformation. It requires good leadership and strategic planning, and that's why, you know, you won't find me kind of bashing NHS leaders or pretending that I could fix the NHS's financial problems if I just kind of salami sliced a load of management posts out. I wish it was that easy, but it isn't true, and we will follow the evidence, not follow the headlines.
Thank you. Number 4, am I right? Was there a question with number 4 or not?
No.
No, right, sorry. Do wave a paddle if you've got another question. I can't see one being waved. Oh, here we go, on number 1 down here. Yes.
Just a question on maths. How many nurses could you employ with £30 billion?
And can I ask, can you tell us where you're from?
That's going to be difficult in view of the question I've asked. Camden Islington Mental Health Trust.
Thank you.
I'm not sure off the top of my head. How many nurses could I employ with £30 billion?
It's the money that we're having to spend to fill the gap.
Oh, I see. Yeah. Well, I think you just kind of highlight the kind of the challenge really, which is it comes back to where I think the real inefficiency lies in the NHS. If you underinvest in the workforce and you're over-reliant on temporary staff, agency staff, you end up spending more money and delivering poorer quality care.
A question that's come in with a lot of interest submitted online is, you know, we've been talking a lot today about short-termism versus long-termism and the challenge. You've been talking about a 10-year plan. The question is, the NHS isn't a political football, yet that's how it's used. Would Labour consider a cross-party consensus approach to the development of a genuine long-term NHS plan? If not, why not?
We've tried to work. We've tried to work cross-party. And when he was chair of the Health and Social Care Select Committee, Jeremy Hunt and I worked together on a number of occasions to try and get the government to agree to our workforce amendment to the Health and Care Bill, now Health and Care Act, and the government voted it down. During the pandemic, there are a whole number of occasions where, I mean, Plan B measures is a really good example where without Labour votes we would not have got it through, and I could not have made it easier for Sajid Javid by committing well in advance of the vote that we would do the right thing by the NHS and the right thing by patients and the public by agreeing to those measures, even where there was a kind of chorus of strong opposition from the Conservative backbenchers. And that gave Sajid Javid the confidence to know he could get the measures through. So I'm always prepared to work cross-party. And, you know, in terms of the timescale that I've set out to try and both arrest the crisis and to build a sustainable long-term future for the NHS, it's an area where I want to build consensus. So I'm always up for building political consensus. The only thing I would say is that this is contested ground. And what I'm not going to do, particularly in advance of a general election, is pretend to the public that politics and political choices don't have an impact. You know, there is a reason why we are in the grip of the biggest crisis in the NHS's history, and it is not the unprecedented pandemic. Of course, the pandemic made life harder, but it doesn't explain why we went into the pandemic with NHS waiting lists already at a record 4.5 million and 100,000 staff shortages and 112,000 vacancies in social care. The argument that says that the NHS publicly funded free at the point of use isn't a sustainable model for the 21st century isn't coming from the Labour Party, it's coming from the Conservative Party and from the right of the Conservative Party. So I would have thought that after 12 years of the Conservative government and the choices they make, compared to the record of the last Labour government and the choices we made, people would now see in our country the very real difference that politics makes and political choices make. And so at the next general election, our country faces a political choice. And the biggest risk for the future of the NHS and for waiting times and staff working conditions and burnout, the real risk is not more of the same with the government we already know, with the devil we know. That's the real risk. That's the real risk. It's more of the same. It's change with Labour that is now the less riskiest option for our country. And so, yes, I'm very willing to work on a cross-party consensus, but don't pretend for a moment that politics and political choices don't make an impact, because surely that's the lesson we've learned after 12 years of Conservative government versus the highest patient satisfaction and lowest waiting times in history delivered by the last Labour government.
One question that's come in that's getting a lot of interest on the sort of online thing is social care. Any plans for raising professional profile and status of those employed in social care to attract and retain this critical part of the health and care workforce? And also any thoughts about raising taxes to pay for that huge increase that's required in social care? We know it's a huge part of the conundrum facing the NHS.
It is. And look, on social care, people rush straight into who pays rather than asking more fundamental questions about what is it that we want a social care system to deliver, and what outcomes do we want to see? And then the question is, how do we fund it? I think similarly to the NHS, at the heart of the social care crisis is a workforce crisis. We are losing care workers to the likes of Amazon because they have better pay terms and conditions. And last time I checked, Amazon were not particularly famous for their pay terms and conditions. So what does it say that we are losing people from a really important public service to employers in retail? So we have got to raise the pay, the terms and conditions, and the status of the social care profession. So we've committed to introduce fair pay agreements across a number of sectors, starting with social care. And my ambition is to raise the status of the social care profession in much the same way as the last Labour government raised the status of teaching, for example.
Thank you. One more question I wanted to squeeze in because I think it's really interesting. The most compelling theme of the conference for me, says this person, has been the imperative of really tackling health and race inequalities for the health and economic benefits for our communities. How would you keep this high on the agenda, given all the delivery challenges you described?
Yeah, well, I mean, it's integral. If you want a health system that delivers better outcomes for your people, you have to understand the diversity of the country.
But how would you do
the
it?
diversity of population. Well, one of the first things that Keir Starmer did when he became leader of the Labour Party was commission Baroness Doreen Lawrence to do a big report on race disparities and health inequalities. And that's given us a clear roadmap across public services generally, and some recommendations in health specifically. You look at the work that some of my colleagues like Bel Ribeiro Addy have been doing on issues like black women's maternal health, for example. That will be important to us too. So I think, again, in stark contrast to a narrative that says that one of the challenges in the NHS is we've got far too many people working on equality and diversity, I think kind of just ignore that and instead focus on the fact that we've got deep health inequalities in our society. And yes, the system can do a lot better at every level, whether we're thinking about the diversity of leadership and governance, or we're thinking about how we really zero in on some of the poorer outcomes in specific services, maternity, as I've mentioned. But I recognise, and Keir recognises, that so many of the health inequalities we see manifesting themselves in the NHS are a product of the wider inequalities in our wider society. And that's why what Keir's emphasised in terms of a wider prevention approach and a wider approach that's focused on tackling inequalities in our society is also going to be essential, because the NHS can't do all of the heavy lifting on this issue. These are wider, deep, entrenched societal problems too.
Thank you. I know we could happily fill another hour with questions and answers from you, but thank you for all the questions that have been submitted, and thank you very much, Wes Streeting, for joining us.
Not at all.
And on taking on so many questions. Thank you.
Thank you very much. Thank you.